So, how is this different from previous outbreaks? Is there something unique about this virus or its transmission?
Yeah, when you're looking at the SARS coronavirus from 2003, that after we controlled the outbreak, it pretty much disappeared. We got rid of the zoonotic reservoir from these markets, and you never heard from it again. You look at something like Middle East respiratory syndrome, MERS, that's become somewhat endemic, especially amongst young camels in the Middle East. Other things such as avian influenza, you see cropping up every once in a while. Often those will go away and then reemerge. But this one is different. It doesn't seem like it's going to go away easily. And part of this is how easily it's transmitted from person to person. It would appear that it's much easier to transmit from person to person than pretty much any of those other viruses I had mentioned. It's probably not as easy as influenza, but we're kind of talking that same ballpark. Going back to 2009, influenza pandemic, H1N1 influenza pandemic 2009, within a week of finding the virus in Mexico, California, it was elsewhere in the world, and within a month. I mean, it was community infections with this novel virus were common throughout the world, and so this is spreading a little more slowly than that, in that we're not seeing community infection in the United States after a good 6 weeks of really intense activity in China. Looks like it's been going on for longer than that within China. But this slow march is really concerning. And it's possible that what we're seeing is a peak in China 2 weeks ago, and then you have with an incubation period up to 14 days, maybe you're seeing a peak of sort of these small fires getting out internationally. And if you just put out all these fires, then maybe we can stop it. I wish that were the case. And there's a hint that we may still be there. But the chances that that's not going to happen is becoming increasingly high. And at this point, we need to prepare for a pandemic within the United States and try to shift our mode from thinking about taking care of one or two of these patients, if it were to come up, to really transforming and thinking about, well, how are we going to do this across the country?